Okay, Medicare annual enrollment is only hours away at this point. So in this live stream, I want to give you a playbook as far as how we can approach the next couple days, the next few weeks, and realistically throughout the entire time of Medicare annual enrollment. This can be a massively confusing time of year for roughly 70 million people out there. I'm here to guide you in any way that I possibly can. So please, if you're watching this video, watching the live stream, watching the replay, feel free to drop your comments down below, either in the chat box if you're joining live right now, or if you're watching the replay, drop your comments, your questions, your concerns down below. I will do my very best to help you through this in any way that I possibly can. I get it. I'm right here by your side. However, I also want you to recognize annual enrollment this year is possibly going to be the most pivotal, the most costly, and the most life-changing year for a lot of people. Why? A whole variety of reasons, which I will cover here in this live stream. We've got a lot to talk about. In fact, I was just reading some different studies on this. Let me tell you a quick little statistic. Last year alone, there was an independent study that was conducted. They found that roughly 7 out of 10 Medicare beneficiaries did not even get a review to make sure that they are on the best plan. I just want to say this much. That is a very, very risky move going forward. Now, if you've been watching the videos on the channel for a while now, you probably know this. I don't tell people what to do. I'm not here to tell you what to think or what to believe, but I am here to help you in any way that I possibly can. It is my dedication to help you understand what is going on, point out anything out there, and to help you maximize your monthly benefit and save as much money as you possibly can so that, your finances are stable. I get it. Living on a fixed income is rough. And if you're on Medicare, I would anticipate you're probably on Social Security, living on a fixed income. Maybe you're retired. Nonetheless, your income is probably somewhat limited. I want to help you in any way that I can. All right, so let's talk through when Medicare annual enrollment opens up here, literally in like less than 48 hours, in a couple days from now. When Medicare annual enrollment completely opens up, let me talk you through some of the details on this, because I've been getting a bunch of questions on this. And a lot of people are wondering, what can I do? What cannot, or what can't I do? All these different questions like this. Let's run through the very long list of things that you can do during annual enrollment. I think this alone should probably clarify a lot of the questions that are out there. But if not, as always, drop them down below. I'll be in the chat box here in just a little while, and I will sit here live with you and talk you through those questions and comments, and I can do what I can to help you through this. Okay, first off, annual enrollment for Medicare, again, runs October 15th through December 7th. And again, first things first, a lot of people look at this timeline and they're like, oh, I got all the time in the world. It feels like a long time. It goes very, very fast. Not only that, it goes very quickly. A lot of times it's followed up with a lot of questions. There's concerns, there's follow-up, stuff like that. It takes time, and especially the time of year that we're getting into, we can easily be distracted by the upcoming holidays and the changing of seasons. It's just easy to lose track of time. And before you know it, December is here. And then whoop, there goes annual enrollment. It's all gone, right? My point is, it's better to act sooner than waiting. Anyway, okay, so this is also by far the most versatile time of year for everybody on Medicare, okay? Now, in January through March as well, there's a time that's called open enrollment. Sometimes it's referred to as the general enrollment period. That's also a time as well, but that's not everybody. That's just Medicare Advantage beneficiaries. Right now is everybody on Medicare, everybody. Roughly 70 million people on Medicare. The floodgates open up and they say, here you go, come on in, do whatever you want essentially with your Medicare plans, your Medicare coverages. You can do it virtually all during annual enrollment, okay? This is the only time of year that the floodgate opens up for everybody and gives you the most flexibility with your Medicare plan. And like I said, it is the most versatile time of year as well to do everything that we need to do. Now, you might be wondering, what can I do? Okay, let me rattle off a list here, okay? There's a whole long list. Let me rattle off the list here. I can certainly go into greater detail if you want me to in all these, but let's go through the list. You can do number one. You can change vice versa between original Medicare and Medicare Advantage, or the other way around, Medicare Advantage to original Medicare. This is always one of those trip line questions because people think that once you're in one, you're locked in forever. Not true. Not true at all. If you're currently on Medicare Advantage, you absolutely can switch over to original Medicare. And if you're currently on original Medicare and think, I don't know if I like this, I want to switch over to Advantage, you absolutely can do that. Okay, that's that. If for some reason you turned 65 at all or retired during the year of 2025 or previously prior to 2025, and you missed your initial enrollment period or your special enrollment period, if you missed that time frame, again, it's a big window, but if you missed it, you can now enroll in Medicare for the first time if you want to during annual enrollment. Okay, that's an option as well. Now also, you have the optionality to go in and you can change multiple different plan options. In other words, if you're on a Medicare Advantage plan, you can come in and you can change your Medicare Advantage plan. Maybe you love your plan for 2025, but maybe it's changing massively and you decide, I don't love my plan anymore. I got my annual notice of change and it's not going to suit me for the upcoming year. You can change your Advantage plan during annual enrollment. Same goes with a supplement and or Medigap plan. There's plenty of options out there. Maybe the plan does not suit you for the new year. Same situation there. You can shop your new supplement plan, your Medigap plan, change it if you want to, no problem whatsoever. Same thing goes with Part D plans, D, okay? If you have a Part D plan, same thing there. You can get a new plan, you can change your plan, or if you do not have Medicare Part D, you can enroll in a Part D plan. That can easily be done as well, okay? So these are a bunch of different things that you can absolutely 100% do during annual enrollment. Now, here's the thing. I just want to say this. Remember at the beginning of this live stream, I said this is going to be the most pivotal, most costly, and the most important annual enrollment that we've seen that is going to disrupt the livelihoods of millions and millions and millions of people. I've been saying this in my videos lately, and this should not be taken lightly. Why? There's all kinds of massive changes that are coming in. A lot of these private insurers, for example, again, I'm just going to pick on Medicare Advantage for a second here. Again, it's not exclusively, but Medicare Advantage gets a pretty bad rap. Let me just point out some of the details. A lot of these private insurers that offer Medicare Advantage plans, otherwise known as Part C, okay, Medicare Advantage is known as Part C. But anyway, a lot of these private insurers are reducing their plan count massively. You've heard me talk about this before in one of the videos. They're reducing plans in the hundreds and hundreds of plans, which may seem like, it's only a couple hundred plans. Who cares? It's only a couple hundred plans across the entire country. But guess what? It's millions and millions of people that are literally losing coverages because the insurer reaches out and says, sorry, plan doesn't exist anymore for 2026. You got to get a new plan, okay? Eliminated, discontinued, it's going away. This will disrupt the livelihoods of millions of people, that in and of itself, that alone. Same thing goes with Part D plans. Hundreds and hundreds of Part D plans are also being eliminated, discontinued, and going away. Not only that, a lot of these big providers out there, private insurers, not only are they eliminating plans, but they're reducing all kinds of things. They're reducing different counties, right? So they may be servicing, 85% of the counties or something across the country. They may only be servicing 83 or 82 or 80% of the counties, which again, only seems like it's like only like a 2, 3, or 5% reduction in counties. You're right, but that's a lot of counties that are being reduced. Some of the big insurers are also removing states, the number of states that they service. It's a lot of people within those states that are literally losing coverages, right? And again, the list goes on and on and on. Because these plans are not very profitable anymore for them, they're literally eliminating a bunch of these plans that do not give them profitability. And they're basically just saying, hey, seniors, anybody on these plans? Sorry, plan's gone, no longer available for the upcoming year, okay? So like I've been saying for so many weeks now and days in my videos, this is so important just to make sure that you're properly covered. Now, I want to throw this out there quickly as well. As long as I'm still kind of talking about Advantage plans and Part D plans, I'm just going to throw this out there as long as I'm kind of on, a little grind here going along with it. In September, so here we are kind of mid-October at the moment, as I'm hosting this live stream. But back in September, if you're on a Medicare Advantage plan or a Part D plan, in September, you should have received your ANOC, which stands for Annual Notice of Change Letter. This is a letter that must be sent out for everybody on these plans, Part D plans and Medicare Advantage plans. You were supposed to get this letter either via mail, like physical paper in your mailbox, or a digital version of it in your email. You're supposed to get this, okay? And basically what it does is it outlines all the changes for your plan. for the upcoming year. I'm just going to say this. Most of the plans are changing in a huge way. I've said this before in other videos, and I'm going to say it again really quickly. If you loved your plan in 2025, please just make sure that you get a review and make sure that your plan that you loved in 2025 is still the best plan for you going forward in 2026. Don't just assume that you think, oh, plan was good, it must still be good. I'm just going to say this. And again, I don't want anybody to think I'm trying to scare you. No, I'm not trying to scare anybody. I'm not trying to instill fear in anybody. I'm just simply saying, don't put yourself at that amount of risk, because if your plan changes, where maybe the offices, the clinics, or the hospital systems that you once went to are no longer within network, maybe your doctor's no longer within network, maybe the procedures or whatever medical needs you have may not be in network anymore, that could be very costly, okay? That's all I'm saying, is just make sure that your plan, whatever it happens to be, is number one, still sufficient for you, or is there a better option for you in your local area for all the plans that are available in your area? Is there a better option that offers something better for you? Lower cost, maybe better coverages, gives you access to the doctors, the providers, the networks, and the doctor groups or the hospital systems you want to be within. What does it happen to be, right? Not only that, I also want you to think about this. This is an interesting thing that we also need to take into consideration that maybe some people don't think about thoroughly, which is this. And again, I'm not sitting here doubting anybody. I know that those of you in this community are very smart. I totally get that. I see your comments. I'm like, let me tell you something I've noticed about you in this community. I've noticed that you ask a lot of really good questions, okay? I've noticed this about you recently. You ask a lot of really good, very highly detailed questions, which honestly I really appreciate. I read through the comments section on the videos, and I see it in the live streams in the chat box, and I'm like, I've noticed this about this community. Very highly specified comments, as in like, what about this group? What about this specifically? What about I'm on this? What about me specifically? Again, it's just really good questions. I really like it, okay? So I'm not doubting anybody here specifically in this community. I'm just saying as a whole, in general, some people may not think about this, but when we are shopping our new plans for 2026, we have to think of this. What do we anticipate for probably the next 15 months? So as we sit right here in the middle of October, what do we foresee with our situation in the next 15 months, right? As in, I think I'm still going to be relatively healthy, or I got this little thing going on. I don't know what it is, but I have this little thing going on, right? Or maybe like, hey, I'm thinking about this procedure. I'm thinking about this one thing. I may want to get it done after the new year, right? Well, my point is with that is that we need to plan appropriately so that we have the proper coverages, the proper plan to account for all of that, whatever it may be. Also, what kind of different changes have happened, if any at all, which, some have experienced this, which is what medical changes have we experienced in 2025 that we may need, additional coverages for, or additional attention or medical procedures, medical visits, things like that that we need to account for the upcoming year, right? We need to think about all of this. That's why I'm saying, think out about 15 months. What do we possibly foresee in our personal situation that we want to make sure that we are properly covered for? And again, it could be something as simple as my medication changed. Okay, that's very important too. Are you on a Part D plan? If so, awesome. But is it still the proper Part D plan that is covering you and your medications? Have you been prescribed a new medication lately? If so, is it being covered, and will it be covered in the upcoming year? Is there possibly a better plan out there that may cover that more accurately and more effectively? Does all this make sense? So we really need to put our thinking hats on for a second. Think, what do I foresee with my personal situation, my finances, my health, my medical needs for the upcoming year? So incredibly important. We have to think about all of this going forward, right? So anyway, that's why this can be a massively confusing time, because it's like, I don't know what I need. And again, nobody knows. We can't foresee the future. At least I can. I'm not sure about you. I can't foresee the future. I'm saying we need to use our best judgment to speculate what we may anticipate for the upcoming year. That's why this is so important, okay? Now remember this as well. Medicare in and of itself only pays 80%. That's why additional plans like a supplement plan, a Medigap plan, or maybe Advantage if you decide to go that route. Again, I know that Advantage isn't for everybody, but it is the right choice for about 50% of beneficiaries because the statistics are actually pretty consistent. It's actually super interesting. Right around 50% of people are on original Medicare with a supplement or Medigap plan, and about 50% of beneficiaries are on Medicare Advantage plans. It's actually very, very interesting. It's almost an even split right down the middle. Okay, so of the roughly 70 million people on Medicare, it's actually a little bit less than 70 million. About half of them, again, Advantage, about half of them on original Medicare. So, you got to know what's best for your situation. Okay, so again, I'm not here to tell you what to do. I'm here to give you information to help you make this a better experience and maybe alleviate some of the frustration, the confusion, all the questions, things like this. Now, let me give a couple little pro tips, which to be fair, I have been mentioning over the last few weeks here. I've been mentioning these in my videos at the very end. Not sure if anybody has heard these, but I just want to throw these out there super fast. Couple quick pro tips are, what is your wish list? Okay, what is your wish list? What are your preferences? Okay, just think of it this way. You're writing up your wish list for the upcoming holidays. Hey, yo, spouse, Santa, whoever it happens to be. Here's my wish list for the upcoming year. Here is what I want, in the upcoming year. I'm just going to write out my wish list. What do you want? This is very, very important. Unfortunately, a lot of the ways that people approach this annual enrollment for Medicare, again, and this goes, this isn't necessarily a bad thing. I'm just trying to help you kind of hack the system a little bit, which is a lot of people just, look through the plans and say, what you got? What do you got there for me? Well, I got this plan over here. Okay, that's fine too, right? Whatever. But my point is if you come to Medicare annual enrollment with a list of preferences and your wish list, as in, I want to see this doctor. I want to see this group of doctors. I want to go to this office, this clinic. I want to have access to this hospital system. I'm currently taking these 1, 2, 3, 5 medications, whatever it is, doesn't matter. I'm taking these. I want to go to this pharmacy. It's very important to me, or whatever it happens to be, right? I want access to these different services. Something else that I mentioned before is, do you need access to certain specialists? Okay, let me tell you a quick little scenario. Me, for example, I want access to a retina specialist. Many of you here in this community know this. I'm blind, but I still go to retina specialists, and I have a very specific guy that I want to go to. Why? It's the same guy that I've been going to for like 15 years or something, maybe. I don't know, maybe longer than that. Been going to the same guy. I don't want to go to somebody else. So when I am here during annual enrollment as well, I'm doing the same thing. Which network gives me access to the guy I've been seeing? Believe it or not, he goes in and out of network all the time. So I am changing my plan all the time as well because of that reason, right? I want to have access to this one doctor that I continue to see. And if I just let my plan ride every year, and if I didn't look through the plan, and if I didn't get a review and change my plan accordingly, I actually did this a few years ago, by the way. I'll tell you in just a second. If I didn't do this, I would be going to him and he'd be out of network. Okay, quick little story. This happened to me years ago. I didn't change my plan, didn't look at my plan. I was just like, I'm young and I'm healthy. I was like in my 20s at some point. I don't remember what age I was, probably late 20s or so. I was like, I'm young and healthy. I'm fine. Didn't change my plan, didn't even look at my plan, just went year to year. And I was like, I'm fine. Guess what? Next year comes around, go to see the doctor, my retina specialist. He does all these tests and I get whacked with a huge bill. And I'm like, what happened? Why didn't you pay? And insurance is like, out of network. You went to a specialist out of network. And I'm like, what? I didn't even know it was a thing. Yeah, exactly. I learned that lesson the hard way. Got all these huge medical bills because now I'm on the hook for this out of network fee. Yeah, not fun. Not fun. I'll tell you that much right now. Not a fun thing to learn, but I learned the hard way and I'll never make that mistake again. Okay. So anyway, a lot of big things happening here. Okay. So just number one, write down your list, your wish list, your preferences. What is it that you want to see in a plan? What is it? Doctors, networks, offices, clinics, hospital systems, procedures. What prescriptions are you taking? All of it. Just write it all down. Just write your situation. What do you foresee for the upcoming year that you may want coverages for? As in, did you have a little medical issue pop up sometime in 2025 that, may continue to need additional attention in 2026? If so, mark that down, right? We got to have note of that as well. Okay. That's that. Next, gather some of the basic data that you just need in order to, make sure that you're getting proper help with this, which would be the easy things. Grab your red, white, and blue card, okay? Have your red, white, and blue card available to you. Just have it at your disposal. If you have a secondary insurance card as well, again, have that at your disposal. Could be a little handy tool. Now, you don't need this next part. It may be a handy tool as well. But in September, again, if you're on a Medicare Advantage plan or a Part D plan, grab your annual notice of change letter. If you got a physical letter in the mail, if you still have it, just grab it. Might be nice to have. You don't need to have it, but just it may be a good thing. Just have all the sources available to you. Again, if you're on prescriptions, grab your prescription bottles. Have those by you, okay? Just so you know exactly what they are. As in, I'm taking 20 milligram lisinopril. I'm taking 20 milligram atorvastatin, whatever, okay? Things like this. Have that at your disposal. Have that available so you know. What pharmacy are you going to? Are you going to the local Walgreens or CVS down the road? Or where are you going? You going to a local mom and pop shop? That's awesome too, right? I used to work at a pharmacy. I worked at a mom and pop, and then I worked at a bigger one, okay? So, been in that situation. And again, this can be so tough during this time of year. I've been in this situation many, many times before, okay? So I'm here to help guide you in any way that I possibly can. Please drop those comments down below. I'll get into the chat here shortly. Now, at this point, I would anticipate, you've probably noticed already, but let me just point out super obvious here. The Partner on the Channel chapter, okay? I talk about them in the videos, but it's 100% for free, 100% for free. Phone number's right here. Write it down, take a picture. I'm going to give you a quick little pro tip here in just 1 second. Anyway, I partnered with Chapter because last year I helped my parents enroll in Medicare. Some of you already heard this story. Let me just tell you the story super fast. Last year, I helped my parents enroll in Medicare. It was a disaster. We had no idea what we were doing. We didn't know Chapter existed at the time, being fair with you. We hacked it on ourselves because that's what my parents like to do. Let's DIY this. My parents love to DIY. Ask my wife, Corey. She's like, your parents love to do everything on their own, don't they? I'm like, yeah, they do. If they can save a buck, they'll do it on their own. Anyway, by the way, this is free. You can see it right there, free Medicare help. But anyway, I helped my parents enroll in Medicare. It was a total disaster. We had no idea what we were doing, had a million questions. We were confused. We were frustrated. It took way too long, had no idea what additional plan to set them up with. It was a nightmare. Okay, let's just say that much. Anyway, after that whole quest, I was like, this is nuts. There's got to be a better way to do this. And I got this community here. I have all of you here in this community. I mean, over 500,000 people here in this community that regularly watch these videos. And I'm like, a lot of you are also on Medicare. I can't imagine that people out there are not struggling with this just as much as my parents did and have the whole laundry list of questions on Medicare all the time. And I was like, there's got to be a better way. Started doing a bunch of research, came across Chapter. They happen to be the leading professionals, leading advisors in this space as far as helping seniors with Medicare. Not only the initial enrollment, but also, yes, securing a supplement plan, a Medigap plan, a Part D plan, a Medicare Advantage plan. You name it, they're helping people. And in the last handful of months, thousands and thousands and thousands of you, since I partnered with them by literally saying, hey, can you help out my community for free? And they're like, yeah, that's like what we do. And I'm like, okay, can you get me a phone number so I can give it to my community to help them for free? And they're like, we'll get you a phone number. Anyway, partnered with them to help you in this community. Phone numbers here. There you go. It's 100% for free. I can tell you this much. Now it's time to give you quick little pro tips. Okay. If anybody's still watching, you want to listen to this because this is the pro tip. This is where it gets really good, really fast. Okay. As I host this live stream right here, right now, it is Monday, October 13th. It's, I don't know, 1:45 p.m. East Coast time, roughly something like that. So if you're watching this live, you know when this is. A quick little timestamp for you. Annual enrollment opens Wednesday morning. Wednesday morning, annual enrollment opens up, okay? Between now and then, this team, they're still kind of slow. Just telling you right now. They're not getting absolutely inundated and swamped with phone calls yet. But in like 36 hours, they're going to be swamped. Their phone's going to be ringing off the hook. That's a good thing because it means that those of you in this community are calling them. By the way, thousands of you have already connected with them. a ton of people in this community saving a ton of money. The average savings is $1,100 from those of you in this community calling them. And I imagine that number is probably going to get bigger. Just saying. Okay. That's the average. After calling them 5, 10, 15, maybe 20 minutes, and you get yourself, possibly a huge savings. And again, no savings are guaranteed. I'm just saying the average person reporting this is saving $1,100. Anyway, the next 36 hours, these people, the advisors, chapter advisors, are still kind of slow. The reason I'm saying that is because annual enrollment has not opened yet. But what they can do is if you call them today or tomorrow, they can still have the time to jump on the phone with you, spend that time talking through the different options that you have, what best options you have for you going forward in the new year. What that is, and they can schedule a time to talk with you, as in they'll call you back. In fact, quick little side note, yesterday at like 6 p.m., my dad calls me. Hey, just got the phone with Chapter. They called me. Chapter called me. This was literally yesterday, Sunday, yesterday, my dad, 6 o'clock p.m. My dad calls me. Chapter just called me. I'm on the books for Thursday. He's literally talking to them on Thursday. Okay. Annual enrollment opens up Wednesday morning. He's got a time and date set Thursday of this week, the 16th. He's on the books with Scott from Medicare, from Chapter. Okay. Literally real thing. My dad just called me last night and told me this. My point is, okay, if you call them, they still are, they can pick up their phone in a reasonable amount of time. They're not getting totally swamped with calls. Just call them today or tomorrow and say, hey, just wanted to set a time with you. Just want to get on your books. Here's my info. What do you got for me? Because they can't technically change plans at the moment, but literally in 36 hours, you could call them and be like, hey, I want this plan. We talked about it on Monday or on Tuesday, right? Today or tomorrow, we talked about it. And can you get me signed up? Bang, 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 done. Great. You're locked in. You're good to go. That's it. Okay. How incredible would that be? And then you get to spend the rest of annual enrollment just enjoying your life and being like, look at all these other people that haven't made the call yet. And, have all these weeks of agony in front of them, trying to figure out what plan is best in all these situations like this. Kind of makes sense? Anyway, my point is, once annual enrollment opens up, the wait time to talk to them is going to be significantly higher, okay? They're still answering their phones as quickly as they possibly can. Wait times range anywhere between a few minutes to, honestly, it could be an hour. Reason being is, there's a lot of people. There's a lot of you here in this community reaching out, asking for that help because it's been massively important, okay? In fact, another true story. I got all kinds of stories for you today. Another true story. Today, I received an email earlier today. Ed Fitzpatrick. Hey, Ed Fitzpatrick, I hope you're watching this right now. If not, Ed Fitzpatrick reached out to me today. He sent an email to me and said, just got home from the doctor. Thank you so much for the help with Chapter. Ed Fitzpatrick, just to give you a quick little side note on him, I'm not going to give you personal details, but he did share some information. And yeah, anyway, about a month ago, he sent me an email. He called Chapter Medicare right there to get some help with his Medicare. They got him a new plan and he's saving $170 a month. $170 a month. That's over $2,000 a year. Ed Fitzpatrick basically just printed himself his own $2,000 stimulus check. I mean, you know what I mean? Literally by picking up the phone, talking for like however long it took him, I don't know, 10, 15, maybe 20 minutes on the phone. And it got him $170 a month, $2,000 plus a year that he's saving after that. And again, he told me this about a month ago. He just emailed me again today. This morning said, just got home from the doctor. Thank you so much for help with Chapter. Amazing, right? All right, anyway, I'm going to jump into the chat box. If you're here live right now, feel free to drop some comments, some questions, some concerns down below. I will do my very best to answer those for you right here, right now. Again, obviously, I can't give specific personalized details because there's just a lot of detail around that. And honestly, you got to talk to one of them about all that. I mean, I'm obviously not your advisor when it comes down to that, but I will do my very best to answer your questions for you. Let me know. Drop it down below. If I don't know the answer, I will be very clear about that. I'm not going to sit here and be like, here's some random answer. If I don't know the answer for something, I will very clearly and transparently tell you that. Okay, I'm going to jump into the chat here. We'll spend some time together. I'll do my very best for you. Let me know what you got. Okay, hang on. This is always the slow part. I apologize. Do my best here. Okay, here we go. By the way, I think there's two people watching right now. Great. Oops. Joey Garcia gave an emoji of a textbook, I think. That's awesome. Joey Garcia, awesome. Nice. Okay. Perfect. There's one comment. There's one comment with an emoji of a textbook. So how cool is that, right? So there you go. All right, anyway. So obviously, if there's no questions, no comments, no concerns, then that's about that, right? So anyway, I think I've said what I need to say, but seriously, annual enrollment starts in like 36 hours, okay? It's going to get nuts. And if I can do anything, just encourage you to at least get a review on your plan to make sure that plan number one still exists and that you're still covered. And that not only that, I mean, you could still have coverages, but is it the best coverage for what you personally need for your personal situation? Remember, these plans are changing so much every single year. We really got to understand, are you still properly covered? Okay. Hold on one second here, by the way. Hang on a second. Oops. Okay. Sorry, I had to send a message real quick. Anyway, so here, quick little side note, quick little story. I said this before in another video. My parents are on Medicare Advantage plans, okay? Advantage plans, and they got their annual notice of change letter, I don't know, a few weeks ago, in the middle of September or so. I was talking to my dad on the phone when he was reading through it, and he's like, we love this plan. We loved this plan for 2025. It's not the best plan for them anymore, right? It's not the best plan at all. So they are changing their plan. Why? Because their plan changed. They loved it in 2025. They still like it right now. They talk about it all the time, but they are absolutely changing for 2026 because it doesn't cover them properly anymore for what they need medically, both of my parents. Anyway, Corey's here to help me out. Please subscribe if you're new here. Again, after you talk to them, after you call them right there, drop a comment down below, use the word chapter. Let me know how it goes, and I will certainly feature you and give you a shout out in a future video. All right, anyway, enjoy your